Now, childhood cancer is cancer that afflicts children before age 18. A child is diagnosed with cancer every 2 minutes, and over 300,000 children develop the disease worldwide each year. There are over a dozen types of childhood cancers and several subtypes. The World Health Organization says the pattern of cancer in childhood differs considerably from those among people of all other ages. In high-income countries, approximately 80% of children with cancer survive 5 years or more after the diagnosis of cancer. Survival rates are as low as 10% in low-income countries. Lack of diagnosis, poor care, and a deficit in specialized medical training for doctors are some of the factors that are affecting survival for children with cancer in Africa. Now, a new pediatric oncology training program aims to bridge the care gap for children with cancer in Africa. Joining us live via Skype from Kampala, Uganda, to tell us more is Dr. Joseph Lubega, a pediatric oncology researcher with St. Baldrick's Foundation. Dr. Lubega, welcome to Africa 54.
Thank you.
So can you give us the scope of pediatric cancer in sub-Saharan Africa, and in Uganda in particular, where you're from?
Yes, so really similar to the rest of the world, the most common cancers we see in children in Africa are cancers that arise from the immune system, leukemias and lymphomas, cancers that arise from lymph nodes. And these comprise about 40% of cancers in children in Africa. But again, we see other cancers like cancers that arise from muscles and kidneys as often as we see them in America and Europe.
Now, we look at the statistics, about 80% of children with cancer will survive in the developed world. But when it comes to developing countries, sub-Saharan Africa region, for example, up to 10%, that's very low.
Yeah, yes, it is. And really, when you think about controlling and treating childhood cancer, you're really talking about one of the areas of highest specialization and needing a lot of expertise in medicine, in all of medicine. And what you see in Africa is a situation where there's very, very limited expertise. Most of these countries don't have a single pediatric cancer specialist, very poor infrastructure to take care of children, and lack of technologies that you need to diagnose, to stage, and to treat cancer. And that situation really explains why survival of children with cancer in this region is really, really minimal.
So if we focus on the lack of expertise, which is something that you aim to tackle with a new project, and we'll talk about that, is it because the doctors, people that are going to medical school are not aware of the scope of childhood cancer, or it's because there are other areas that are more in demand on the continent?
Exactly. I think for so long the focus in most developing countries has been on infectious diseases, diarrhea, pneumonia, malaria. But as those conditions get more and more controlled, ministries of health and the public is becoming more aware of the scourge of cancer and the impact it has on families.
And let's talk about your initiative to bring training to African doctors with regards to childhood cancer. And you're doing that in partnership with the St. Baldrick's Foundation. Tell us more.
Yes. So for so many years, pediatric cancer wasn't on the radar of government, philanthropy organizations, even academic centers. But through the experience of Baylor College of Medicine, where I serve as faculty, we've had a lot of lessons learned through taking care of children with HIV. And what demonstrated is really you can treat some of these difficult to treat diseases, even in the settings like Africa. And thankfully, foundations like St. Baldrick's Foundation came out with a specific funding dedicated to training and supporting experts who are working in the US, like myself, to come to Africa and start supporting developing comprehensive pediatric cancer centers. Recently, Baylor College of Medicine received a major gift of $50 million from Bristol Myers Squibb Foundation towards a similar cause of training all the different kind of specialists you need to take care of children with cancer. Okay. So really, very quickly, this is picking up in terms of people realizing that it's a big problem.
Okay, Dr. Lubega, we have to leave it there. Thank you so much for joining us today.